Assalamu alaikum. My dear students, I am Dr. Sagia Afrose, Associate Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. Today I am going to discuss about insulin in detail. At first, I am going to tell the mechanism of action of insulin or how insulin acts. The mechanism of action of insulin binds with the insulin receptor, and insulin receptor has two subunits. One is alpha subunit, another is beta subunit. Insulin binds with the alpha subunit of insulin receptor, and thus it causes the activation of receptor, and there may be some conformational change into the receptor. There is catalytic loop of the beta subunit come into closer proximity, and phosphorylation of the tyrosine residue of beta subunit occur. This tyrosine kinase activation causes the other tyrosine kinase activation and phosphorylate the different proteins like insulin receptor substrate. Insulin receptor substrate binds and activate the other kinase such as phosphatidylinositol 3 kinase, which causes the further phosphorylation, and this network of phosphorylation occur within the cell and results in multiple effects. That is, increase the glycogen synthase activity, that is increase glycogenesis, increase the peripheral glucose uptake, decrease the lipolysis and increase the lipogenesis, decrease the proteolysis and increase protein synthesis, increase DNA synthesis and cell growth and division. Now, I am going to tell about the indications of insulin or where insulin used. The absolute indication of insulin are type 1 diabetes mellitus, uncontrolled type 2 diabetes mellitus where the oral drugs fail, gestational diabetes mellitus, and all type of diabetic complications like diabetic nephropathy, diabetic neuropathy, diabetic retinopathy, diabetic ketoacidosis and hyperosmolar non-ketotic states. Pre-operative, per-operative and post-operative diabetic patient, hyperkalemic condition and diabetes mellitus with severe infection. These all are the absolute indication of insulin. Now, I am going to tell about the adverse effect of insulin. That is, the important adverse effect of insulins are hypoglycemia, hypoglycemic shock, weight gain, insulin hypersensitivity, lipodystrophy. There are two types of lipodystrophy, one is lipoatrophy and another is lipohypertrophy. Insulin edema, insulin resistance. In later part, I am going to discuss about the hypoglycemia and insulin induced hypoglycemia, insulin resistance and lipodystrophy in detail. At first, I am going to tell about the insulin induced hypoglycemia. What is insulin induced hypoglycemia? The major cause of insulin induced hypoglycemia are a delay in taking meal, inadequate carbohydrate consumption, unusual physical exertion, large dose of insulin for immediate needs. These are the major or important cause of insulin induced hypoglycemia in that people, those who are used to take insulin routinely. Now, what are the clinical features? How we identify the insulin induced hypoglycemia? What are the symptoms and signs? There are two symptoms and signs. One is sympathetic hyperactivity and another is parasympathetic hyperactivity. What are the signs of sympathetic hyperactivity? Tachycardia, tremor and severe sweatings, these are the important signs of sympathetic hyperactivity, and nausea and hunger pain, these are the important signs of parasympathetic hyperactivity. If this patient is untreated, it may progress to convulsion, coma and death. If one diabetic patient undergoes insulin induced hypoglycemia, then what may be the treatment or how we should manage a case of insulin induced hypoglycemia? According to the condition of patient, we have to treat the patient. If the patient is conscious, then simple sugar or glucose solution should be given, preferably in a liquid form, or dextrose tablet, glucose gel, honey, sweet, any type of sugar containing beverage or food can be given. If the patient is unconscious, then 20 to 25 ml of 50% glucose solution should be given by IV infusion over a period of 2 to 3 minutes. 1 milligram of glucagon injection should be injected either by subcutaneous route or by intramuscular route, and small amount of honey or sugar syrup can be inserted into the buccal pouch. Now, another important adverse effect of insulin, that is insulin resistance. We have to know what is insulin resistance and how it occurs. A suboptimal response of body tissue, especially the skeletal muscle, liver and adipose tissue, to physiological amount of insulin is called insulin resistance. Relative insulin resistance is the integral of type 2 diabetes mellitus. The important factors that promote the insulin resistance are advanced age, because insulin sensitivity decline with age, and another factor like obesity, sedentary lifestyle also promote the insulin resistance. There are some other factors like pregnancy and oral contraceptive pill that induce the reversible insulin resistance, and other rare causes like Cushing syndrome, pheochromocytoma, a low titer of circulating immunoglobulin G or anti-insulin antibody that can neutralize the action of insulin and produce insulin resistance. So, we are going to know about the lipodystrophy. What is lipodystrophy and how it occurs in case of insulin administration. We know that animal insulin preparations sometimes leads to atrophy of the subcutaneous tissue at the site of injection. If the insulin injection site, the same insulin injection site is repeatedly used, then lipodystrophy occur. It is two types, one is lipoatrophy and another is lipohypertrophy. Thank you all.